Hello. Just gonna be where I have more light in my house. I'm doing well. And yourself? Yeah, we're switching places.
All right. Okay. So let me just tell you what's happening here. I have you in Dockery Hall, and there's
Great.
maybe 100 students here. No pressure. And and you know what? You're up on the screen, and so when I'm going to introduce you, and then you'll be talking, but you'll probably be talking to a wall. That's what you'll get. Oh, you can turn.
No.
Maybe we'll turn the computer around. We'll try that. Okay. But
Purple works best for you.
I'm really afraid to do that because I'm really awful with technology. I'm afraid something like that. But anyway, let me introduce you. Okay. Oh, you turn yourself around. All right. So I'm going to introduce you, and then we'll get started. Okay. Hi, everybody. As you can see, Patrick Smith is up on the screen, and he is coming to us from Lesotho. Is that where you are?
Lesotho, yeah.
Lesotho. Yes, thank you. Patrick is a 2016 graduate, right?
Correct.
Yes. Villanova College of Nursing. And so he took the course that you have taken, but since graduating, he went on to do a Fulbright and is now working with Partners in Health, which is Paul Farmer's organization. You may have heard of either one of those, either Paul Farmer or Partners in Health. And so he's going to share with you what his experience was as a student kind of coming to the thought of wanting to do global health, and then where he has gone on in a short year and a half since he's graduated. And one other thing I want to add, and Dr. Mariani's in the room as well, so there are many wonderful, wonderful things about teaching, but one of the best things is to see the success of your students. And so this is an opportunity for Patrick's success, and we certainly will be hearing your successes as well. So Patrick, I am going to spin you around and see how that works out.
Great. Sounds good. Thank you so much.
Can you see everybody?
I can see a lot of people. Hi, everybody.
Okay, I'll try. Okay, you get busy?
I'm not yet.
Okay, good. There, that's all.
Life had.
Okay,
Oh,
there you go.
great. Well, hello everyone. First, let me just say, if I cut out at any point, I am really sorry. I'm coming to you live from a very old cell phone in Lesotho, a country which is a 26-hour flight away from where you are now. So if there are technical problems, there usually aren't. Please accept my apologies in advance, and I'm sure we'll be able to make it work. Can everyone hear me okay-ish?
Yeah.
Sweet, cool. So thank you so much for the super kind introduction. I'm just gonna try to return the favor right off the bat and say one of the great privileges of being a student and one who's been able to have the privilege of traveling abroad is that I get to share a part of myself with people on the other side of the world, and I think that I am very much formed by all of the great mentors I had at Villanova in no small part. So every time I have a chance to chat with people from Villanova and return to what I think are my roots, it's a really great privilege, and whenever I'm able to see smiling faces of Villanova professors, that makes me super happy. So thank you for the opportunity to chat with everyone here. So I'll just try to give like a high-level overview of kind of what my experiences looks like for like 5 minutes or so, and then I don't want to take up too much time just droning on because I'm sure you guys might have your own questions, and I hear you come from different backgrounds. So if there's anything that you would like to ask me here, or via email or anything, or in a follow-up conversation, I'm more than happy to chat. So just as a starter, I came to Villanova as a nursing student. So I was in the normal BSN 4-year program. I came into nursing with a mom who had a background in primary care and had worked in that world on non-communicable disease management for about 15 years. And I had kind of an interest in public health and primary care at the outset, I would say. That said, I was also one of those people who had basically no idea what I wanted to do with my life. I was simultaneously kind of interested in global health and public health policy and maybe like bedside care and maybe international diplomacy, and I was kind of all over the place. So it's a great credit to the professors I had at Villanova for kind of supporting me on what I would say is a very circuitous, kind of winding journey through the world to wherever it is that I am now. So basically, I would say I came in, and my first exposure to public health research, which is what I'm doing now, was through, beyond my kind of nursing research courses, a public health research internship that I had after my sophomore year. I had the opportunity to work with a mentor at Johns Hopkins on her nursing research project, which was really great. And give me some hands-on exposure to the process of kind of like producing a paper and presentations from not data collection, because data was already collected, but sort of from like data analysis to production. I think through that experience, I got a little bit of exposure to the capacity that nurses and anyone has to influence policy through research, and from there it was kind of like a bug that I couldn't let go. So I kind of was simultaneously nurturing interests in clinical care and research and global things, and reading books by Paul Farmer and some other figures in the field, and decided that one of the sad things I thought about my nursing background was that I didn't have the opportunity to study abroad in a place where I really felt compelled to go. So after my junior year, with the support of the College of Nursing, I actually was able to go to Ghana for a couple months with an organization called Unite for Sight, and learn a little bit about their model of care delivery, which is essentially through rural outreaches, they kind of try to provide specialized eye services for rural dwelling patients with everything from cataracts to refractive errors, things that are pretty simple to manage, but really that limit functional ability in a way that can change people's lives. So that I think was also great firsthand exposure, mostly to different, I had there, thought about the world in different ways. And I would say that was an experience that was my first time outside of the US, challenged me to kind of think about my place as a nurse in the world, and what kind of work I wanted to do. So as I was doing that, I started thinking about post-graduation plans, and I applied to a few clinical positions, and was sort of still all over the place, but thinking about what I wanted to do and when. And so I would say that that's still in some ways where I am, but there's a lot of experiences out there, and particularly with a nursing background, I don't think there's any end to the things that you can do. That said, I decided that I wanted to potentially have an opportunity to build on the lessons I had learned abroad, and I applied to a Fulbright, and kind of put in the work to try to establish a relationship with Partners in Health, which, as Dr. McNamara said, is Paul Farmer's organization, and Jim Kim, president of the World Bank, was also a co-founder. And so I had a great opportunity to work with them ultimately last year on an assessment of Lesotho's village health worker program, see kind of what was well, what was not working well, and what were some areas for improvement, and then translate that to sort of research and advocacy materials that would support policy improvement, and also kind of national scale up of this model that we thought worked really well. Carried that forward. I happened to be in the right place at the right time, and have an opportunity to stay on for another year, doing another health policy evaluation with the Ministry of Health and Partners in Health. And so here I am now, working on an assessment or evaluation of basically a primary healthcare reform that aims to kind of take a lot of power from the central Ministry of Health and push it out to districts, and strengthen the community health worker model and facility staffing nationwide. that basically we took sources from central places and pushed them out towards mostly healthcare workers to, basically say, like, these are the people who are delivering services. If we have an adequate number of them and they're well trained and they're provided, all the things that we need to deliver this care, they're going to do it a lot better. And we think that that can be done professionally in some cases at the district. So we're kind of now going through the process of seeing, there was a pilot of that intervention and we're seeing how it worked, what worked well, what didn't, what can be scaled up, what needs to be revisited. So that is that's where I am now. I am living in this like super mountainous kingdom where it is currently nighttime and also spring. So I'm 6 months and 6 hours off view. But it's been a lot of fun so far. So if there's anything that you would like to know about kind of how I see my role as a nurse here or what kind of work I'm doing in the day-to-day, I'm happy to kind of answer whatever questions you have, or I can keep.
Your role as a nurse and where you are?
Yeah, absolutely. So I would say it's complicated, and I go through different thoughts every day on what my identity is as a nurse doing this kind of work. I'm obviously not delivering clinical services, but I'm operating, I would say, within an environment where there are some really unique challenges that I think are best understood by some with a clinical background. 25% of adults in Lesotho have HIV/AIDS. The TB incidence is the second highest in the world. Maternal mortality, there are something like 1,024 deaths for every 100,000 live births, which is among the highest in the world. And these are kinds of things that I think oftentimes people can look at them and they just see numbers if they come from a more technical background. When you come from a nursing background, I think you see those numbers and you envision patients and you envision the different barriers that individual patients might face to getting care to prevent or treat those conditions. For me, I think that's a powerful grounding source of knowledge that keeps me inspired on a day-to-day basis, obviously because I'm able to bring it back to the patient level, but that also opens my eyes to areas where policies might work or not work, depending on how they're dealing with the holistic barriers that someone might face. So whereas someone from a technical background or even a strictly medical background might come in and be very disease focused, I think nurses are kind of more holistic in our view, and we can see the variety of influence faults and how they might play out. Certainly some of the barriers to health are different in Lesotho than they are in Philadelphia or than they are in Boston, where I'm originally from. But I think that in terms of the perspective that we bring to thinking about problems, they can be very similar. All of which is to say, people ask me all the time, like, but are you really a nurse? And I would say a resounding yes, because the way that I think about the world and my place in the work that I'm doing is first and foremost from the perspective of a nurse. I would also say that in my day-to-day, nursing comes up a lot more than non-communicable diseases, rage on Lesotho, and particularly in the capital, Maseru. There is access to health. Like, I'm used to my shopping at a grocery store where I can buy a lot of vegetables and like fresh fruits and all these things. But there's also abundant access to Coca-Cola and to some really poor quality food that can create similar problems as what we see in the U.S. where there are food deserts. And I would say that's true in Maseru, the capital where I live, and it's also true in other places. That essentially means that a lot of my coworkers, many of whom are nurses, have diabetes and hypertension and come in with blood glucoses of 300, and that's kind of normalized. And one of the things that I do on a daily basis is actually work with my coworkers in an unofficial capacity to help them manage those things. So I think you can probably notice my hair is like flopping down. That's because I just ran through the shower, because right after work every day, I kind of run an after work workout club. And so I would say that, there's innumerable examples of opportunities wherever you go, whether you're practicing clinically or not, to use the nursing background. And I would say in nutritional counseling, using the motivational interviewing skills to try to help improve people's health and a health promotion capacity is also something that I feel tied to every day. So, I would say, nursing owns all of the research that I'm doing. It grounds my understanding of how I work with my coworkers and, how I help them to be healthier. And, that's a two-way street as well. I learn incredible amounts from them every day. And this is just kind of one of the things that, given my nursing background, I can sort of give back. So I think that's a very windy answer to that question, and go on for hours and hours, I'm sure, providing other examples of when people, didn't notice that there was no soap in the health center, but I, as a nurse, did, because that's the first thing you do when you walk in the room is look for soap. I would say myself as a nurse every day, committed to just kind of improving systems as opposed to individual patients' health right now.
Thank you very much. Does anyone have questions? Would you mind coming up? And I should see you, and everyone can hear your questions. And if anyone else
I'm not sure how this is looking on your end. It looks like the video is getting a little choppy, so. Sorry.
Yeah, no, that's fine. Okay.
It's still not working. Sorry. Yeah.
Hi, I'm Curlin, and I was wondering, when did you apply for your Fulbright? Like, at what point?
Great question. So I applied for Fulbright. I think I submitted my application the September of my senior year. So basically, there's a multi-stage application process. It's actually not as daunting as it seems. It's just a lot of revisions usually that people make to the same application. I kind of started thinking about what I might want to do in June, July, I would say, before my senior year, and then applied and didn't actually hear back until April, I believe, that I actually was awarded a grant. So it's kind of like a hurry up, do a lot of drafts and wait sort of process, but there's, I would say, a wonderful, wonderful resource in the Center for Research and Fellowships, who supported my grant application kind of all the way through and helped me to think about what I wanted to do and who I wanted to work with. And they can provide you with a wealth of information about how that all works.
All right, thank you.
For sure.
And just to add to what Patrick said, for those who are interested, as he said, the Office of Research and Fellowships, which is in Gary Hall, is very eager to help students with outside grants. So if you have something, they're great, they're amazing. So, any other questions from the group? Okay, I have some questions then for you, Patrick.
Great.
Oh, wait, somebody else has a question.
Hello. My name
Hello.
is Ashley, and I just looked up on the map where you are because I had no idea. And I noticed that you're entirely encapsulated by South Africa. So I'm just wondering how that affects maybe the politics of the area and the health of the area, thinking that South Africa might have a lot of more areas of affluence than the country that you're in.
Yeah. So yeah, I would say that in this, yeah, there's so many directions to go with a response to that question. If you know anything about the history of the region, which if you don't, do not feel any, I did not really before I spent time here. The region of Southern Africa is kind of plagued by a really dark history of apartheid, where South Africa does have a lot of areas of affluence that I think emerged largely as a result of subjugation of native populations. And so apartheid formally ended in this community that I was born. And the region itself, I would say, is still grappling with a lot of the legacies of colonialism that brought. Essentially, all of which is to say, there are aspects of South Africa that are very developed. There are aspects of South Africa that are also very not developed. So a lot of the same challenges that Lesotho faces, South Africa does as well, particularly for lower income and traditionally more vulnerable populations. There are benefits to being in South Africa, in that there are a lot of things that are built up development-wise. It's very easy to procure items. For instance, for the project I'm working on, there are places we can go to get things that we need to do the work that we need to do, and that's easier than if we were in a country that was further away from South Africa. The South African chain grocery store that I shop at frequently is super convenient and has access to a lot of creature comforts and food. I'm forever grateful for that. But then it's also not kind of there throughout the country. And I would say Maseru kind of functions actually with Lesotho being entirely encapsulated by South Africa, as you said. Maseru sort of functions in some ways as a South African city, where we have access to a lot of those things. But when you get out into the mountains, which is most of where I work, it's a very, very different country. And we have, access to some of the roads and stuff that have been developed in the last 10 years, but there are some unique challenges associated with being in Lesotho that aren't as significant as they are in urban areas and wealthier areas of South Africa. Yeah, I don't know if that answered your question though. So there, as I said, there's a lot of different directions to go with that.
Patrick, what programs do you see that have worked and that have been effective? And what about them were effective?
Oh, wow.
I know. See, it's better if you guys ask questions. I'm sure.
That's a hard one. So I would say I've been working within Partners in Health primarily. So I would say most of my things come from that particular lens. I would also say, in general, I've not seen any unqualified successes, and I've not seen any complete failures of programs. So I would say, for the Village Health Worker program that I spent 9 months working on, I think there's a lot of things that went really well with it. They implemented this program on a huge scale throughout 4 districts after they had an established model. Sorry, I should back up 2 steps and explain a little bit more about PIH's work in Lesotho. So we have a few different irons in the fire, so to speak. The reason we came here 11 years ago is to work with the Ministry of Health in supporting 11 really, really hard to reach sites. So these are health centers that are often more accessible by airplane than by car. Lesotho is a small country, but it's super mountainous. So there are places where there just are not room. And PIH initially came here to work in those settings and to provide clinical services in those settings. One aspect of our work there was a community health worker program that was based on existing models that worked pretty well in Haiti and Rwanda and Malawi, other places where partners worked previously. We implemented a structure that we thought would work, and then kind of assessed how it worked well, how it didn't, what the areas for growth were. When we started to work on this project that I'm currently evaluating, called the National Primary Healthcare Reform, that essentially emerged as a result of the government saying, whoa, like those 7 sites that you're working at really are working well, how can we make the national health system work more like that? Partners in Health kind of investigated what the aspects of the system that worked well were, and what worked well and what didn't, and tried to harmonize the Ministry of Health's vision with their vision and what had proof of concept worked for. And I would say that process of taking a model that you think has worked somewhere, thinking about how it fits into the current environment, and then being open to continual reassessment is a really important exercise. So before we implement this model in the other 6 districts of the country, we really want to understand in these other 4 districts, which is 72 health facilities, right, 7, how did it go? What were the challenges? What worked well, what didn't? And then how do we make it sustainable on a larger scale? I think there's always challenges to see it, but the organization, the nature of the project. But one thing that I really like is that the approach of the organization I happen to be working for now is very much focused on public sector accompaniment, which is sort of the idea that like anything that we do is sort of like worthless if it doesn't support existing infrastructure. So everything that we want to do, we're doing because the Ministry of Health thinks it's, we're partners with them. And I would say that that's been privilege to work with an organization. Your philosophy is very and capacity building is great. That doesn't that all of our
Patrick, could you just repeat that again, the philosophy of the organization, because you broke up a little bit. So the value of
Gosh,
working with
yeah, I'm
philosophy.
sorry.
Yeah. Sorry.
Thank you for jumping in. So the philosophy of the organization I'm working with, I think, is very focused on the idea of public sector accompaniment, which is essentially saying like anything that we do has to be grounded in support for local infrastructure and for the local government. So our priorities are the same as the Ministry of Health's priorities, and our role is really here. We're trying to come in and not dictate our priorities, but rather work with them and say, what's going to work well for you? Here's what we think has worked well in the past. How will that fit into this existing framework? And then how can we support you in achieving that vision and mission? That's not how all organizations operate. And, in some cases, I would say it's not how all organizations should operate, but that's been one of the things that I think has been really cool about the work that I've seen is that it's very grounded in the idea of doing something once, seeing how it works, and then it's kind of the nursing process. It's like you assess, you plan, you implement, and then you evaluate. And then I think the best organizations continue that sort of nursing process and program development process throughout. I've also seen examples with other organizations where they've done really, really awesome work at the community level and at the facility level and at the public level, supporting the Ministry of Health in other ways like that. And I think the opportunity to work in Lesotho, where there aren't too many organizations, is really cool because you can get a sense of the lay of the land a lot easier than you might in some other environments.
Besides the Ministry of Health, you work with other stakeholders?
Partners in Health does as an organization. The work that I've done is specifically on this like national health reform, which is the Ministry of Health is our main partner. But in that capacity, I've also had the opportunity to work with people from Clinton Health Access Initiative to learn more about the work of Mothers to Mothers, which is another community-based organization that's trying to prevent the spread of basically maternal to child transmission of HIV/AIDS through community education efforts. They have a really cool model I am very much a fan of. Partners in Health also does work with Elizabeth Glaser Pediatric AIDS Foundation, EGPATH, which is a big implementer of USAID programs in Lesotho. And then I would say also, the Ministry of Health is kind of comprised of multiple levels in Lesotho. So we have the Central Ministry, which is working in collaboration with, but also very different from the Ministry for the district level. So I would say my work is kind of. Oh no!
Yeah.
I'm so sorry.
It's not your fault.
No, it's this technology. My phone actually overheats. Okay. So struggles. So the Central Ministry of Health, and then the district level Ministry of Health, and then like the health facility level Ministry of Health, kind of operate in different ways. And so, whereas our work with the Central Ministry of Health might be like, how do we plan this and fund this and make sure that the human resources are in place to implement it well. Our work with the district might be more specific to their unique challenges. And then at the facility, it's like a level more specific. And I think anytime you're in an environment like this too, where it has these really significant challenges, and it's small, there's a lot of funding coming in, which means that there are a lot of implementing partners, which means that basically like you have to kind of learn what other people are doing and try to not fight for space, but see how you can combine your work and work together. And so there's a lot of like Lesotho specific organizations that we've also been able to kind of collaborate with and see, you know, how are our models similar, how can we kind of have a model that's jointly supportive of the Ministry of Health. I don't know if that answers the question.
No, it did. Any other questions for Patrick? This is a chance to talk to somebody who, those of you who may be thinking about doing international work, who's doing it right out of school, ask questions. Faculty have any questions?
Maybe what is he thinking of doing next?
The question was, what do you think you'll do next?
So that is a wonderful question. Huh?
Besides go to bed, since we're keeping you up late.
No, you're not. You're not keeping me. I have a bunch more stuff to do next time. It's all good. So I think after this, my plan is kind of winding and forever changing, and I think I tried to kind of make reference to that earlier. In the near future, I would say I'd like to go to grad school for more of a health policy focus. I am interested in also kind of transitioning long-term towards a career more in the U.S. I've loved the opportunity to work abroad, and I still do. But I also think that long-term, Lesotho is very far from my family and very far from home, and I'll probably be investigating ways in the next like 5 or 10 years to transition to being closer. I think for the interim, like that's looking at grad school programs and specifically scholarships in the UK, which would help fund grad school. I'm also looking at some programs concurrently in the US with a research focus, so more of a doctoral focus probably. But I think my path could go sort of one of two ways at a high level, and it would be either I go to grad school right away, or I sort of continue this work for a while, or I get 3 ways, or I kind of return to the US and get the clinical practice that I would really like. So I think if I were to do that, it would look more like trying to get experience in primary care, which is, I think, an area that has a lot of area for growth in the U.S. I'm very interested in the global spread of non-communicable diseases, and the many things that are tied to that. Partially as a function of a lot of conversations with my mom and the work I've done here, and where I think will help and public health are trending as fields. I would like to ultimately find out kind of working on NCD prevention globally with a focus on vulnerable communities in the U.S. And that will either come through clinical practice or grad school, and I would say probably both. It's just a matter of kind of assessing the timeline. So we shall see.
Any other questions? Well, Patrick, thank you.
Thank you so much for taking the time.
What's that?
Thank you so much for taking the time.
Sure. I was just afraid we were going to make your phone melt down, and I don't want that to happen. We appreciate everything, and get a good night's sleep. I'm being the mother now. We will be in touch soon.
Sounds great.
All right.
Wonderful chat as always, and thank you for being willing to share time. I'm sorry if our connection was super spotty. I should just say I'm always happy to chat. If anyone does think of anything after the fact, I'm more than happy to make myself available via email or a phone call that hopefully won't cut out every minute. If anyone should want. So thank you so much. It's a privilege.
So if the students are interested, I will give them your email if that's okay.
Great. Absolutely.